Hello everybody, welcome to the hajatopathology.com case of the month series. Today's case is a 40-year-old male with a bladder mass. So we have here a urothelium with some papillary-like formations. These are not real papillae, but just the undulation of the surface urothelium. And just beneath the urothelium, we have this spindle cell proliferation. Looks like a little bit edematous, but certainly this is a spindle cell proliferation. And when we look at other chips, we see that this proliferation infiltrates through the musculus properia, and therefore a little bit concerning. So when we see a tumor, a spindle cell neoplasm in an organ, the first thing comes to mind here, another area that showed infiltration of this tumor. In an organ, when we see a spindle cell tumor, we first think of sarcomatoid carcinoma, right? In a breast, we think of metaplastic carcinoma, and in uterus, we think about a carcinosarcoma or mixed Mullerian tumor. And here in a bladder, we also think about spindle cell. We think about the sarcomatoid carcinoma, and of course we see a lot of atypical cells here, with the quiet here, and some hyperchromatic cells, and so we order cytokeratin here, and as you see, the surface epithelium and these cells quite stained with pan-cytokeratin. And we did another one and CAN 5.2 here, and that's again diffusely positive. So shall we find out the case like sarcomatoid carcinoma? But here's a very important pitfall in bladder, and every pathologist should know. So the first thing that's against the sarcomatoid carcinoma, we don't have any dysplasia or urothelial carcinoma in situ or any papillary carcinomas in the surface. And another thing is, although this is a spindle cell proliferation, this is a little bit less cellular and more edematous compared to the sarcomatoid carcinoma of bladder. And when we come here, we see some mitotic figures, although we see some, and this is a quite nice one, like sun or ring, or here another one, mitotic figure. The cells are accompanied by inflammatory cells, and we see some here ugly looking cells, hyperchromatic cells. There are some ganglion like cells here. Another one is here, and the cells look like myofibroblastic, or let's say maybe rhabdomyoblastic. These cells could be seen also in bothroid rhabdomyosarcoma, and therefore we did a Desmin staining here, and it was negative. And this is one of the staining that leads to the diagnosis. Here, this is the staining of the smooth muscle type of staining. This is a diffuse and strong diffuse cytoplasmic staining, both seen in the musculus properia and the vessel walls. But here in the tumor, we have this myofibroblast pattern of staining of it, smooth muscle actin. This is called tram tract staining pattern. And then we ordered an ALK staining here, and ALK was diffusely positive, so therefore leading the diagnosis of inflammatory myofibroblastic tumor. So cytokeratin staining is a very important and common pitfall in the for the IMTs. IMTs stain with cytokeratins. And here's another case in a child, and again the bladder. As you see here, we have this pushing infiltrative pattern into the musculus properia, and of course in the childhood the embryonal carcinoma is much more prevalent and first comes to mind. Again we have this very nice spindling myofibroblastic cells accompanied by quite a number of inflammatory cells, and again cytokeratin was positive, not that diffuse, but also we have this focal cytokeratin staining in this example of IMT, and in the biopsy it was more prominent. As you see here in the biopsy of this case, cytokeratin was more evident. But again, when we order as SMA, you see again the leiomyomatous smooth muscle pattern of staining, in contrast to the myofibroblast type of staining, the tram-track staining. And ALK was again diffusely positive in this IMT of the children. In this case, desmin was also positive, patchy. It showed a patchy staining with the desmin, which creates again in the a problem with the differential diagnosis of embryonal rhabdomyosarcoma bothroid type. And so we ordered in myogenin just to exclude the embryonal rhabdomyosarcoma. Here it's clearly negative. So in this case of the month, we've shown two nice cases of IMTs. The importance of these cases are the IMTs may express cytokeratins, which creates an important and essential differential diagnosis pitfall with the sarcomatoid carcinomas. Thank you.